$5 trillion, with costs growing faster than wages and inflation. The average Hoosier family faces healthcare premiums of almost $25,000 and deductibles of over $4,000. In Indiana, the median household income is below $70,000. These high costs put significant financial stress on families, and it forces them to make difficult financial decisions. I regularly hear from constituents in rural communities that they constantly have fewer options to access care. Mr. Hemsley, UnitedHealth Group is the largest health insurer in the country. What concrete steps are you taking to ensure that patients in rural communities have strong access to care?
We are trying to be supportive of both all of the care facilities and sources in rural communities, as well as independent pharmacists, 26,000 or so in our networks. And we are moving forward on efforts to see if we can facilitate faster payment to them and financial support, and just put as much business with them as we can, because we need them and need them in our networks to really provide the care for those that we cover for health.
Thank you. And Mr. Hemsley, I also hear from a lot of rural providers that they're constantly forced to accept smaller reimbursement rates from insurance companies that make it harder for them to survive. What are you doing to ensure that rural providers are being reimbursed at a fair rate?
Well, it's actually in our best interest to make sure that they're reimbursed, because we actually need them. As you point out, there's a scarcity of these resources, so we tend to be very forward-thinking in terms of reimbursing in rural communities, because we need them and we need their services.
Thank you. And all of our witnesses today in their testimony mentioned the need for affordable health care. And frankly, I couldn't agree more. The healthcare industry at large is very quick to finger point as to why costs are too high, while also taking zero accountability. What role have private insurers played in the cost of healthcare, high healthcare premiums? Mr. Joyner.
So, Congressman, it's a good question. I would say that the insurers today play a very important role in terms of reducing costs. So the role that
what role have you played in the cost of high premiums?
Of cost of high premiums.
Yes, sir.
I would suggest that our role is to basically combat the rising costs that actually lead to premiums. So our focus has been reducing the cost of hospitalizations, or keeping people healthy to prevent hospitalizations, and actually focusing on the cost of branded medications in this country. So if you look, those are the big cost drivers that lead to the premiums. And as an insurance company, that's the focus that we have, is to make sure that we're continuing to focus on engaging.
Thank you. And Mr. Markovich, same question to you. What role have private insurers played in the high cost of premiums?
We haven't done enough to improve the system. We're still using faxes and CD-ROMs and clipboards and photocopiers, and some of these technologies are what we're using for processes like prior authorization, provider directories, credentialing, and so we should have done more, like the financial services industry, to allow for financial transactions in the background. We should have been doing more up until this point. I'm proud to say that we are now on prior authorization, so I'm hopeful that will change.
Thank you. And what concrete steps are your companies taking to reduce premiums? I will start with Mr. Cordani.
Congressman, thank you for the opportunity. I'd highlight three I referenced earlier today. With the employers we work with in America, we spend time first trying to ensure that the benefit design has zero costs for preventative care and low or zero costs for generic drugs for chronic care. So ensuring there's ease of access and support of either staying healthy or optimizing your health outcomes. Second, extending access to services that are cost effective, like in-home infusions, virtual care, and integrating behavioral health with physical health. And then, as you heard earlier today, expanding value-based care, rewarding the doctors and the care teams that are providing the highest quality and supporting them with technology and services, and expanding services for them.
Thank you. And very briefly, Ms. Bordeaux, same question. What concrete steps are you taking to reduce premiums?
I would point to three very practical things. One is paying for value to try to incent positive outcomes. We're investing heavily in fraud, waste, and abuse to try to take that out of the system. Also streamlining, as I said, the administrative issues on prior authorization, working to deliver fair value across the entire healthcare system, and trying to simplify it. And we're trying to offer a range of options and products so that consumers have choice in what they need most.
Thank you. All stakeholders play a role in skyrocketing healthcare costs, and the Hoosiers that I serve literally pay the price. My constituents cannot continue facing higher healthcare costs year after year, especially while not seeing better health outcomes. Thank you. Mr. Chairman, I yield back.
Mr. Horsford.
Thank you, Mr. Chairman. I know it's been a long day for all of you, but it's been a longer day for a